Okay, I'm going to walk into my patient's room and perform hand hygiene. I'm going to identify my patient using two patient identifiers, name and date of birth. I'm going to explain my procedure. I'm going to explain that I'm going to suction his trach, and if at any time for him, if he's uncomfortable, to raise his hand or wiggle his legs. I'm going to assess lung sounds. Okay, and I'm going to assess his oxygenation and make sure it's good, and I would hyperoxygenate 100%. Then I'm going to apply this. Then I'm going to check to make sure my portable suction is between 5 and 10. I'm going to put on a glove to do this. Okay, it's between 5 and 10. Alright, I want to gather my supplies, so I have hand hygiene, a drape, my suction kit, and then I'm going to need sterile water. Perform hand hygiene. Okay, so I would open this, and the inside is sterile, but the 1-inch borders are not. Actually, I want to do this. Then I'm going to want to open my suction kit, and the same applies. The inside of this is sterile, the outside is not, and I'm going to open this. And dump my contents onto my sterile feed. I'm going to apply my sterile gloves. Actually, I'm going to set this up first. And I can touch the outside of this because the inside is what we want to be sterile. Gonna make sure this content is not out of date, and just make sure it looks okay. It hasn't been opened before, so I don't have to discard. I'm just gonna pour some in there. Then put on my sterile gloves. If that outside part would have touched my wrist, I would have gotten new gloves. Okay, now I'm going to hold the suction part with my dominant hand, and the where I hook up to the suction with my non-dominant hand. And this whole time I'm making sure I'm not turning my back on my sterile field. If I was to turn my back, I'd have to start completely over. So now this hand is not sterile, it's just clean. And I'm going to turn on my suction. And I want to check first. Okay. Make sure it's still working. And then insert this 3 to 5 inches until I meet resistance or the patient coughs. And if that happens, I would come back half an inch. Okay, so I'm going to insert 3 to 5 inches. And then intermittent suction on the way out and circular motion. So making sure I don't hold for longer than 15 seconds. And then I want to clean this. Now I'm going to assess my lung cells with my non-sterile hand. Compare them to baseline. The lungs are clear and the O2 sat is 98, so it's good. Making sure I'm still not turning my back. If he would have gotten short of breath or his O2 would have dropped, I would ambu for 3 to 6 breaths. Okay. I'm not sterile anymore, so. And I would discard of this in my biohazard bag. I would clean up my mess, put all of this in my biohazard bag, and I would continue to assess my patient's oxygenation status with lung sounds and O2 sat, and I would leave my patient with side rails up, call bell, all my safety checks. Put on clean gloves, take off this mask, take off my gown. Then I would take off my clean gloves and perform hand hygiene and document.